Hi, my name is Caroline Gurney and I'm the CEO of Future Generation. And I'm joined here by Emily Fuller, our Social Impact Manager. And we're here today to talk about our exciting new partners for Future Generation Global. We did an expressions of interest earlier this year and we got 175 applications. And we've worked very, very hard to get to the 14 that we've now selected. They're incredibly exciting. It works into a fantastic portfolio, I would say, of not-for-profits, and it really goes across that sort of mental health spectrum. I'm really interested, Emily, in how people talk about the mental health promotion and prevention space. But tell us exactly, what is it?
Yes, thanks, Caroline. So our partners represent a spread across what we call the mental health promotion and prevention spectrum. And you can see that on the slide that we've got there. And the delineations aren't quite as neat as they look there, but it's a useful way to show the range that we were looking for with the portfolio. So our partners' work ranges from universal prevention, which targets all young people, to selected prevention, which works with young people or groups of young people that we know are at higher risk of developing mental health issues, and indicated prevention, which focuses on young people that are already showing early signs of poor mental health.
So universal prevention, that's sort of our first segment for a number of our partners. What is universal prevention and what are our partners in that space?
Sure, they use a range of approaches. Big Art and Mind Blank both use arts and culture to engage young people in positive experiences and deliver messages about mental health and also about seeking help when you need it. There's a whole lot of evidence about the benefits, mental health and well-being benefits of participation and creation of art and culture. On a completely different tack, we've got Smiling Mind that uses technology to equip young people with skills to maintain their well-being and their mental health in good times and bad times. And their aim is really to develop lifelong skills for mental fitness from a really early age. We have Project Rocket, that is a youth-led movement, incredibly energetic partners, and they mobilise school children to combat bullying in all its forms and to create school communities that are inclusive and positive for young people to be a part of. And our final partner in that universal space is an advocacy and training organisation called Prevention United. And they're really about building the momentum and raising awareness about the importance of that focus and more investment into wellbeing and prevention.
Thank you. So we've gone through, as you can see from this slide, we've now gone through the universal prevention, and now we're going to go through selective prevention, where you're working with young people who are at the risk of actually developing mental health. You can begin to see that. And what are the organisations there?
Sure, thanks. Autistic young people are 9 times more likely to self-harm than other young people. Our partner ICANN Network is an autistic-led organisation, and they provide autistic mentors for autistic young people. And that has an incredible impact on building self-acceptance, self-confidence, and a positive sense of self for those autistic young people. We work with a terrific organisation from South Australia called Youth Opportunities, who run a really successful personal leadership program, and they describe that as hardwiring resilience for life. Young people in regional areas are another group that we know are at particular risk, and we also know there are far less support services available in those areas. So we have a number of partners who are based in regional areas and also work in regional areas. Youth Live for Life was started in the Macedon Ranges of Victoria, and they mobilise whole communities to recognise the signs of emerging mental health issues and to be able to reach out to young people early to support them so their issues don't escalate. We also have Backtrack, which is from the New England in New South Wales, and they do whatever it takes for as long as it takes to keep kids alive, out of jail and chasing their hopes and dreams. And that could be education, employment, or a home, you name it.
We also have 2 not-for-profits really targeting, Aboriginal people that are of can be of high risk of developing mental ill health? Who are they?
Absolutely. We've got two partners that are Aboriginal organisations, WANTA, which is based in the Northern Territory, and the Western Mandulia Institute from Western Australia. And they, in different ways, are both working to build a resilience and strengthen the well-being of Aboriginal young people. And they share a focus on ensuring that there are Aboriginal-led approaches available to Aboriginal people that are both sort of clinically and culturally informed. And they want to make sure that those are available, particularly in our most high-risk regional and remote areas.
So the last sort of segment, as you can see from the slide that we're focusing on, is the indicated prevention. And that's really young people that are already showing those signs of mental ill health. Our final three partners actually work in that space, which is, as you can see from this chart, is really on the indicated. And that's young people that are already showing, mental health, ill health issues. And Who are those three partners?
So we've got Happy Paws, Happy Hearts, which brings together rescue animals with young Australians who are socially isolated, and they learn how to care for those animals. And in that process, they learn how to connect with others. And that can have a really profound effect for their mental health and well-being. And Happy Paws finds that the recovery process of those young people mirrors that of the animals that they're caring for. We also work with Human Nature, which is based in the Northern Rivers of New South Wales. And they describe themselves as bridging this huge gap that we see between youth work and crisis mental health intervention. And they use nature therapy, adventure challenges to mentor and provide therapy to young people who haven't been supported by the mainstream system. And they use that to help them overcome trauma and to build their skills in resilience and well-being. And then we have Reach Out, who's a long-term partner of FGG, and they're the most accessed mental health online service in Australia. And they provide a whole range of support and information to young people, families, and teachers. But they describe their key impact as bringing the pressure down in the moment, or equipping young people who are in distress with strategies to de-escalate that. And that's so important, because now you can wait up to 6 months to have an appointment with a psychologist if you can afford it, or to get an appointment at Headspace.
Emily, thank you so much. What I think is really amazing, and just listening to you, is the fact that, they're all across Australia. We have that really strong rural and regional representation. We have some of our partners that are working across the Australia and some working in specific areas, which I think makes a really amazing portfolio. And the fact that they're all small to medium sized and they have low government levels of funding, I think, working with them, I really believe that we can get that really important social impact. We have a slide here that actually shows that, and I think it's a really strong story. I just wanted to thank you for going through our new partners, but also to thank our pro bono fund managers and all of our providers who actually help us make this a reality, and to our shareholders who are very much on board with what we are trying to do. So thank you.